Welcome to the Inside Edge Competent Person Training for Respirable Crystalline Silica in Construction Workplaces. You are participating in this training because you may be exposed to respirable crystalline silica in your workplace. For the remainder of this training, we will simply refer to this as RCS. This training will cover what RCS is, the tasks done in your workplace that can expose you to RCS, and how breathing in silica could affect your health. This training will also review what Inside Edge has done to help protect you, such as provide you with equipment that keeps dust from the air. You will also learn about the major requirements under the RCS standard. This training will also help you identify the competent person for RCS. The competent person is someone Inside Edge designates to help minimize RCS hazards in the workplace. You will also learn the purpose of the medical surveillance exam and what makes up the medical surveillance program. The medical surveillance requirements provide at-risk employees access to medical evaluations to help with early detection of health effects related to RCS exposure. Let's start off by describing RCS and how you may be exposed. Silica is a mineral. The most common form is quartz. Silica is found in many materials used in construction. This includes natural materials such as sand, rock, and stone. It also includes man-made materials such as concrete, brick, block, mortar, tile, and artificial stone. Dust-containing crystalline silica is generated when, for example, power tools are used to chip, cut, saw, drill, grind, sand, or crush crystalline silica-containing materials. It is also produced when sand is used in abrasive blasting. This dust contains respirable particles of RCS. These particles are very small, about 100 times smaller than a grain of sand. The picture shows how much smaller RCS is compared with this small coin. When these particles are inhaled, they can travel deep in the lungs where they become trapped and cause diseases. More workers died in 2014 from silicosis than in fires or in caught-in crushed events. What happens to the mineral in your lungs? Nothing. It settles in your lungs and your immune system attacks it. Cells encapsulate it and die, and this process repeats. Silicosis is non-reversible. There is no specific treatment for the disease other than administration of drugs to alleviate inflammation and maintain open airways, or administration of oxygen therapy in severe cases. Initial exposure leads to inflammation and irritation in the lungs and eventually moves to fibrosis. Employees exposed to RCS could develop silicosis. There are 3 forms of silicosis that can develop based on how much silica employees are exposed to and for how long. Most employees who develop silicosis develop chronic silicosis. It typically develops after repeated exposure over 10 years or more. Accelerated silicosis typically develops after 5 to 10 years of exposure to high levels. Acute silicosis typically develops after exposure to extremely high levels, such as abrasive blasting with sand. It is the rarest form of silicosis. All forms of silicosis are permanent and irreversible. This means that once you have silicosis, it does not go away or get better, and there's no way to cure it. Silicosis can get worse over time and can lead to disability or death. The top picture shows a healthy lung, and the bottom picture shows a lung from a silicosis victim. You might have symptoms in early stages of silica-related diseases, but symptoms can develop as the disease gets worse over time. Symptoms of lung disease associated with RCS exposure include shortness of breath and coughing. In some people, these symptoms can get so severe that they cannot work or do common everyday activities. For example, someone with silicosis might have trouble walking at a normal speed or going upstairs. Fever, weight loss, exhaustion, and coughing up blood can occur with severe lung disease, lung cancer, and lung infections. People who have lung disease, such as silicosis, have a greater chance of developing lung infections, such as the flu or pneumonia. Inside Edge provides the tools and equipment for you to use to protect yourself from being exposed to silica dust above certain levels. This decreases the chance that you will develop RCS-related diseases. This pyramid shows OSHA's hierarchy of controls, which lists the type of controls in order of their effectiveness. It shows the most effective form of protection, engineering controls, at the top of the pyramid. Engineering controls remove or isolate silica dust at the point where it's made. The second most effective type of protection is work practice controls. Work practice controls involve doing a task in a way that reduces dust exposure. The least effective type of protection is personal protective equipment, such as respirators. This is shown at the bottom of the pyramid. The RCS standard requires use of engineering controls and work practice controls first to reduce exposure. Respirators are for use only if engineering and work practice controls aren't sufficient to reduce exposure. If you are assigned a respirator, you will also have a separate respirator personal protective equipment training. The three major types of engineering controls for RCS dust are wet method, vacuum dust collection systems, and isolation. Wet method involves using water or foam to keep dust down and out of the air. Another type of engineering control for RCS dust is a dust collection system. Vacuum dust collection systems remove dust at the point where it's made. These pictures show employees grinding with and without a dust collection system. The picture shows how capturing the dust at the point where it's made greatly reduces the amount of dust in the air. The third type of engineering control used for RCS dust is isolation. Isolation separates the employee from RCS dust, but this does not help the other people in the area. Ensure to post signs and block the area as much as possible to limit others' exposure. Some example of engineering controls at Inside Edge are dust control kits for all upright sanders, powder mixing buckets, and all rotary hammer drills, dust shrouds for grinders, HEPA vacuums for dust control systems, warning signs to caution and control traffic, and lastly, respirators. Do not improvise on the safety equipment. Use only engineering controls designated for the specific tool. Training on how to use effective work practices is another way to stay safe at work. Work practice controls involve doing tasks in a way that decrease exposure. One type of a work practice control is ensuring the engineering controls are properly working. An example is checking that nozzles on a tool with wet controls are not clogged and are pointed in the direction where dust is produced. Immediately addressing an engineering control that is not working properly is another example of a work practice control. If you can see dust levels starting to increase, this is a sign of a problem with engineering controls. Another example of a work practice control is using cleaning methods, such as wet sweeping, to decrease the amount of dust that gets into the air. You might also schedule dusty tasks when other employees will not be around. Personal protective equipment such as respirators are at the bottom of the hierarchy of controls. Inside Edge offers you a respirator if engineering controls and work practices are not enough to control exposures down to the exposure limit. Even when respirators must be used, engineering and work practice controls must be used to lower exposure as much as possible. One of the major reasons why engineering and work practice controls must always be used before respirators is because they decrease dust at the point where it's made. As a result, they protect everyone in the area. Respirators are effective if they are properly selected, fitted, maintained, and worn. However, they only protect the people wearing them. Engineering controls, like the shown dust collection systems, are available to you. You have or will be trained on the proper use and maintenance of this equipment. It is standard workplace practice to ensure your equipment is safe and dust collection systems are operational before each use. Here is a list of some common equipment we use and then ensure you have proper dust collection systems for reducing your exposure. Rotary hammer drills for boring holes into concrete, installing fixtures, placing relative humidity sensors for moisture testing, and core sampling to determine the presence of an intact vapor retarder or alkali silica reaction. Walk behind saw with fixed grinder using diamond impregnated masonry blade to prepare concrete joints. Jackhammers and handheld chipping tools. Handheld grinders for scarifying the concrete surface with a diamond impregnated cup wheel to remove the carbonate layer, residual adhesives, coating, or surface contaminants, and for edge grinding, polishing around the perimeter of the floor. Walk behind milling machine, shaver, and planetary grinder to profile concrete floor, to repair uneven concrete, or create a surface profile conducive for resilient flooring or epoxy coating. Upright sanding using scrape-away heads, blades for removing residual adhesives prior to laying the new flooring. Here are some more examples. Sanding flooring to remove adhesive or prep. Dry sweeping flooring. Only use this if wet sweeping or vacuuming with a HEPA vac is not feasible, and always wear your respirator rated a minimum APF 10. Mixing powders such as thinset, grout, and floor prep. Always use dust shroud and HEPA vac, dust collection system with a filter cleaning mechanism, and wear a respirator rated a minimum of APF 10. Using compressed air to clean tools and clothing, only when used in conjunction with a ventilation system designed to capture the dust cloud that is fitted with a dust collection system with a filter mechanism, and wear a respirator rated a minimum of APF 10. This chart explains the process that could expose you to RCS dust, what the engineering work practice controls are, and when you must wear a respirator. This is what the Table 1 entry looks like for the walk-behind grinder. Ensure the saw is equipped with an integrated water delivery system. Integrated means that the system must be built into the tool. A water hose taped to the saw is not considered integrated. The system must also be continuously fed with water to the blade. Occasional application of water is not sufficient. Follow the manufacturer's instruction for minimizing dust release. Such instructions might include water flow rate and how often the water should be changed. Manufacturer's instructions that are not related to controlling dust, such as the type of engine oil to use for the tool, do not have to be followed under the Silica standard. This is what the table entry looks like for the handheld and stand-mounted drill. Following the Table 1 chart, ensure the saw is equipped with commercially available shroud or cowling with dust collection equipment. No respiratory protection is needed when the controls for this equipment is fully and properly implemented. This is what the Table 1 entry looks like for a jackhammer and handheld power chipping tool. Following the Table 1 chart, ensure the tool is equipped with an integrated water delivery system or dust collection system. Ensure to use your respirator when the chart describes its time. This is the Table 1 entry for the handheld grinder. Following the Table 1 guidelines, ensure the grinder is equipped with the integrated water delivery system or dust collection system, such as a cowling or shroud. Ensure to use your respirator when the chart describes. This is the Table 1 entry for the walk-behind milling machine or floor grinder. Ensure the same safety equipment is attached. No respiratory equipment is needed when following safe work practice controls and engineering controls. Ensure to take the same care to minimize dust while cleaning equipment. In some cases, you may have to perform tasks that are not on the Table 1 chart, or you choose to use another type of engineering or work practice control for that task. In those cases, you must follow the alternative exposure control method option. In this case, Inside Edge will test the area to see what the exposure limits are. As earlier mentioned, as a result of the exposure limit tests that have been conducted, please ensure to follow the engineering controls, safe workplace practices, and wear your PPE dust mask while working on processes that create dust. Ensure to follow up with the respirator and RCS requirements that include medical exams and routine training. Always remember that anyone helping with the task is also considered to be engaged in the task. If a helper is keeping the vacuum and hose, cords, etc. out of the tool operator's way, the helper is engaged and must have the same protective gear as the operator. Certain cleaning methods can increase your exposure to RCS by releasing dust into the air. Therefore, the RCS standard requires you to avoid cleaning methods that release dust into the air and to use cleaning methods that reduce the likelihood of exposure. Dry sweeping and dry brushing should not be used if they can contribute to RCS exposure. Compressed air should not be used to clean clothing or surfaces. Less dusty cleaning methods, such as HEPA, filtering, vacuuming, wet sweeping, or the use of oil or wax-based sweeping compounds, should be used instead. Inside Edge has a written exposure control plan that describes tasks involving exposure to RCS. The plan also addresses engineering controls, work practices, and respirator protection for each task. Housekeeping measures are also addressed. The plan also describes procedures for restricting access when necessary to limit exposure. When employees are engaged in tasks that require a respirator, use under the RCS standard, access to those higher exposure areas must be restricted for employees who are not involved with the task. This means that employees who are not involved in those tasks should not be in the area. Training will be provided during new hire orientation, when job duties and hazards exposure change, as well as on an on-needed basis. If you would like a copy of the written exposure control plan, please ask your manager. Inside Edge must designate a competent person to frequently inspect the job, to assess tasks and equipment to be sure all controls are in place and working properly, note any deficiencies and take immediate action to correct, identify any exposures being caused by third parties and take immediate action to protect people, then record the date and time of inspections and the actions taken. This person is you. Successfully completing training and passing this exam will be what's required for all designated competent persons at Inside Edge. Inside Edge offers a medical exam if you will be required by the RCS standard to wear a respirator for 30 or more days a year. This involves an initial medical exam within 30 days of assigning you to a job that requires respirator use under the Silica standard, unless you have had a medical exam for RCS within the last 3 years. Then there are periodic medical exams at least every 3 years if you will perform tasks that require you to wear a respirator under the RCS standard for 30 or more days a year. Note that the medical exam for RCS is different than the medical evaluation required by the respirator protection standard. If you will be required to wear a respirator, you must undergo the medical evaluation for respirator protection before you are fit tested for the respirator or wear a respirator in the workplace. The medical exam will include a medical and work history. This will include questions about your health, past jobs you have done, and exposure on those jobs. A physical exam including listening to your heart and lungs with a stethoscope and measuring blood pressure. A chest x-ray to help evaluate the health of your lungs. A lung function test. This involves using an instrument called a spirometer to measure how much air you can blow out and how fast you can blow it out after taking a deep breath. A tuberculosis test is done only for the initial exam, which is the first exam you receive under the Silica standard. Getting the exam is important for the following reasons. First, an exam can determine whether you have a disease related to RCS exposure. This will allow you to take action to protect your health, including quitting smoking, getting jobs with lower exposure to RCS, or getting flu shots. The exam will also determine whether you might have any condition, such as lung disease, that might not have been caused by RCS exposure, but that might make you more sensitive to RCS exposure. In addition, the exam will let you know whether you have a health condition that does not allow you to wear certain kinds of respirators. This could prevent you from endangering your health or life by wearing the wrong kind of respirator. The healthcare provider will explain the results of the medical exam to you and give you a written medical report within 30 days of the exam. The report will include the following information. If you have a medical condition related to RCS exposure or one that might make you more sensitive to RCS. If the healthcare professional recommends limiting exposure to RCS. If the healthcare professional recommends that you be examined by a specialist. The healthcare professional does not give a copy of your report to your employer. It belongs to you alone. Inside Edge gets a written medical opinion from the healthcare professional. This is different than the report that you get. This will only include the exam date, a statement that the exam met the requirements of the RCS standard, and any recommended limitations on respirator use. Only if you give written permission to the healthcare provider will the medical opinion by your employee include more information. This could include recommended limitations on silica exposure or recommendation to go see a specialist. Inside Edge does not receive information about your health exam because employees might fear retaliation or discrimination based on this information. Under the Occupational Safety and Health Act, employers must not discriminate or retaliate against an employee for participating in medical surveillance or based on the result of their medical exam. The cost of this medical exam is paid for by Inside Edge. Inside Edge employees exposed to silica in their workplace must also receive training under other OSHA standards. The Hazard Communication Standard requires that you be trained on the written hazard communication program in your workplace and where to find the information about those hazards. The Hazard Communication Standard also requires employees be trained on how substances such as silica are detected in the workplace. If respirators are used in your workplace, you must also receive training required under the Respirator Protection Standard. Thank you for your time. I hope you enjoyed this session. If you remember only 2 things from today's training, please remember, limit the dust and wear your respirators. Please reach out to your lead, manager, or human resources if you have any questions or concerns. Have a great day.